BPPV by Grace Taylor, Mariella, and Rebecca. Also known as benign, non-life-threatening, proximal, sudden, positional, which occurs with the head position changes, and vertigo, which is the spinning sensation. There are actually 4 systems which help with this BPPV in order to keep us balanced. First is the visual system, then the vestibular, the proprioceptive, and then the central processing system, also named the CNS. All these systems help us stay balanced. Our vestibular system has 3 semicircular canals. These canals are named the horizontal, the anterior, the posterior, and they also respond to angular acceleration. These canals tell our brain which way our head is moving. When our head turns, endolymphatic fluid inside the canals move the opposite direction, causing the nerve to send a signal to our brain. There are also 2 otolith organs, named the saccule and the utricle, which respond to linear acceleration. They tell our brain if our body is moving up, down, or side to side. Inside these otolith organs are tiny calcium carbonate crystals called otoconia, which shift as our body moves.
In BPPV, these crystals from the utricle become displaced into the semicircular canals. When our head changes position, the crystals cause the endolymphatic fluid in the canal to move, and this causes us to feel dizzy. The crystals are typically only displaced to one of the semicircular canals. While this could occur in any of the 3 canals, it is most common in the posterior canal. The most common cause of BPPV for those under the age of 50 is due to head trauma. Natural age-related changes to the vestibular system can cause BPPV in older adults, and BPPV can occur after long periods of inactivity.
Approximately 20% of all dizziness is due to BPPV. Patients with BPPV endure vertigo for a brief period of time, generally less than 30 to 60 seconds, and it often happens when they get up from bed or roll over in bed, look up into the sky or into a high cupboard, or bend over to pick something up. Other common symptoms include a rotary nystagmus, which is a circular rotation of the eyeball, postural instability, unsteadiness, and loss of balance. All of these symptoms are generally intermittent.
Some common non-audiologic symptoms of BPPV include nausea and vomiting as a consequence of the dizziness and migraines. You can see Homer Simpson here spinning. The Dix-Hallpike is used to diagnose BPPV. With the guidance of a vestibular audiologist, the patient's head is turned 45 degrees to one side and is then laid back. At this point, their head is tilted down 30 degrees from the body. In this position, it is held there for a minute. The whole procedure is repeated on the other side. If a patient has BPPV, you will observe a rotary nystagmus as seen in the next video clip.
Thanks for watching our video on BPPV. For more information, check out our references.